Jane Guptill, and I'm an assistant professor in the Faculty of Health Sciences at the University of Ottawa. And I belong to the group Masks for Canada, which is a volunteer organization, grassroots group of healthcare workers, academics, and other professionals, including engineers, who collaborate to advocate for evidence-based and equitable public health measures during the COVID-19 pandemic. We have produced open letters to decision makers and a range of educational materials for the general public, including short videos like the one that we're recording today with Dr. Karen Wang.
Thank you, Dr. Wang, for coming to speak to us today. I'll start off with the first question. Why don't you tell us about yourself and your qualifications? And Christine will ask the questions from this point.
Okay, so I'm Dr. Karen Wang. I'm an assistant professor at the University of Toronto, and my clinical work is as an adolescent inpatient psychiatrist at a tertiary care facility in Toronto. Prior to entering medicine, I was actually a high school teacher and guidance counselor for the Toronto District School Board for 7 years. And I completed my medical school training at McMaster University and then subsequently finished my general psychiatry residency training at the University of Toronto. I then went on to do a child psychiatry subspecialty fellowship. And subsequently, since finishing residency in 2018, I've also completed a Master's of Science in Quality Improvement and Patient Safety, particularly because I'm concerned about issues around equity, efficiency, and effectiveness of care for patients and families in the youth mental health system. My areas of clinical research center on the intersection between quality improvement and education, and also in particular, the introduction of something called measurement-based care to track and improve mental health outcomes.
Fantastic. So let's look at this first kind of question that we're going to talk about. So in your experience, what's been the impact of the pandemic on children and youth?
So from a mental health perspective, I think there's been colossal impact, both to children directly, but also indirectly through the way that the pandemic has impacted families and social support systems that would typically be able to really help buffer environmental stressors and shocks. As we all know, the pandemic has led to severe restrictions and lockdowns, and this has caused major disruption to the life and well-being of millions of children across the world. And to be quite frank, I don't think we will truly understand the full impact of this pandemic until we follow these children longitudinally for the next decade or so. Oftentimes, early childhood adverse events, you may not see immediate sort of psychological changes or even physical changes. However, this can lead to epigenetic changes that increase risk for mental illness. So it's somewhat premature to say what the longer term impact would be. However, we do know that there are many sort of cross-sectional studies that are now in the research literature that speak about impact to children. And I'm going to draw upon a fairly recent systematic review that was actually published in Child and Adolescent Mental Health just this past year in 2021, actually, sorry. That was done by a number of researchers in BC and also McGill. So in their systematic review, they found over 100 studies that focused on this topic of children and youth mental health and the impact of COVID. And a couple of things I just want to highlight from their study. So first of all, they noted that there was a great deal of COVID-19 related fear for children and youth, not just pertaining to sort of the physical consequences of COVID-19, but also the fear of its impact on their school year, their future plans, on being socially isolated from peer groups. And I think this fear is very understandable and to be expected. Just having fear does not necessarily mean that you will then subsequently develop depression or anxiety. However, their self-reported fear was also associated with higher levels of depression and anxiety symptoms as measured through screening questionnaires, as well as lower sort of emotional well-being and also difficulties with sleep. It's interesting too that, that the anxiety and depressive symptoms were more frequently observed in sort of this sort of post-lockdown period. So there may be like a temporal correlation between significant lockdown measures and increasing depression and anxiety. There's also some studies that showed a higher utilization of mental health services. This was when analyzed emergency visits. They noticed that there was an increase in sort of mental health related presentations. Again, it's sometimes hard to tell exactly if the trend is worsening, because there are also other studies that seem to show the opposite finding. And I do want to point that out, that it is a bit of a mixed picture at this point in time. There have been other studies in the UK that actually show that child and adolescent sort of referrals for mental health services remained about the same or actually declined. And personally speaking, what I've noticed in my work as an inpatient psychiatrist is that our numbers haven't necessarily gone up, but the complexity and the length of stay has gone up. We've also started to see that there are certain subpopulations within certain psychiatric disorders that seem to be more disproportionately affected. So this would include kids who have what we call neurodiverse conditions, such as autism, attention deficit hyperactivity disorder, obsessive compulsive disorder, Tourette syndrome. And in part, I think with the pandemic, access to these types of specialized clinics and services have been quite limited. A lot of them have shut down, have transitioned to online. And for many of these kids, they need to have in-person servicing. They cannot quickly pivot to just virtual services. So it's, again, not entirely surprising that there are subgroups that are more severely affected and are reporting sort of worsening behavioral issues and concerns. The same seems to happen also with kids with chronic physical conditions as well. Kids with IBS, with cancer, again, higher rates of sort of self-reported worry, anxiety, depression. So I could probably keep going on and on, just talking about all the ways in which the pandemic has affected children. But I think, what's maybe a hopeful message is that there are also some silver linings. There are qualitative studies that have also spoken about how kids have enjoyed certain aspects of the pandemic, in the sense that they have more family time, there's greater sort of connection via virtual means with their friends. There's less school stress in some ways. Many schools have, lifted certain assignments or evaluations in recognition of the fact that it is already stressful enough for children. And of course, there's also some kids who, if they have been struggling with social anxiety, they actually do find that, being online and away from in-person schooling may temporarily relieve their anxiety as well. So I do think there may have been some pluses as well with the pandemic, but again, it will take time to really see what the long-term effects will be.
Okay, so can we talk about resilience? Can you speak to children's resilience and how we can better support children and youth during the pandemic?
Sure. So I think the general public often thinks of resilience as sort of a static trait or quality. You either have it or you don't. But actually, we should be thinking about resilience as a skill or a dynamic process that, in fact, you can increase your capacity to withstand or recover from significant challenges. In fact, there are numerous definitions of resilience. One definition is the capacity to withstand or recover from significant challenges that threatens one's stability, viability, or development. Another definition of resilience is your ability to sort of deal effectively with stress and pressure, to cope with challenges, to rebound from disappointment, mistakes, to develop clear goals, to problem solve, to interact comfortably with others, etc. So I think with children, first of all, children are very resilient. They can cope with significant challenges. However, they do need support, and primarily the family structure is usually the mechanism by which children can sort of be buffered from some of the situational stressors. There are studies now arising that point to certain protective factors. So having positive family relationships obviously is key. Having positive social relationships, physical exercise is also another one. And I think practically speaking, there are actually many things that parents or caregivers can do. So with the pandemic, there's been so much sort of change, fluctuations, and people often during these times of stress sort of lose that sense of rhythm to their daily life. And I think it's really key. And again, we're starting to see some studies coming out talking about this, the importance of actually having a daily routine, having consistency, having set meal times. That creates a sense of normalcy for children and for teenagers. They know what to expect. Also, disconnecting from social media, having periodic, periods where you're just fasting from media, not sort of going online. Again, over time, we're starting to see how ongoing social media consumption can actually aggravate mental health issues. It can lead to greater negative mental health outcomes. And this is not just for kids who are going online, because they're hanging out with their friends. If they're spending lots of time gaming, if they're using their smartphone, if they're constantly on the internet, this can all sort of add up and start contributing to mental and psychological problems. And so as a parent, I think it's really key to monitor their daily usage. And that's pretty easy nowadays. We have that sort of technology available on the smartphone. You can see that, or you could track how many hours they're gaming. And speaking to your children early on, if you're starting to notice that there are significant behavioral changes or challenges as a result. So I think those would be some of the key things to sort of think about and really speak to your children to help them figure out what are some ways in which they can start to build that capacity or that resilience over time.
Great, thank you. So we know stability is important to children. So what are the effects of all of the changes? So oscillating between online and in-person school, those sorts of changes. What can we do to foster a stronger sense of stability for them?
Yeah, stability, as I mentioned, does help to promote a sense of psychological safety for children. And as I mentioned, if there's a way to keep things consistent, because there's already so much disruption happening on the school level, as a family system, if there's a way for you to maintain consistency and routine, this I think will help to offset some of the turmoil that then arises in other areas. So there are very practical and also creative ways I think that parents and educators can help to create a sense of consistency. For example, just having the same time for meals each day, setting time for reading together each night, having a pleasurable hobby or activity that you can do collectively, having sort of consistent virtual meetups or in-person meetups with family and friends during periods where people are feeling more stressed out. Even in the classroom, there are teachers that have adopted like a mindfulness moment. And this is just an opportunity for them to sort of check in with the kids, make sure that they're feeling calm before they start the day. And all these little things can actually start to really make a difference. Even in the hospital, we have weekly team huddles where we'll gather together as clinicians. We'll debrief how the week has been going because we are providing ongoing care for teens and for families who are very distressed. And so we even for ourselves benefit from having this sort of collective time together to check in. I think it helps to build a sense of cohesiveness, a sense that we're in this together, that we can surmount these obstacles. So again, hopefully that provides you some sense of what might be helpful from a very practical standpoint, but don't underestimate just even the small things that you can do on a consistent basis to build a sense of stability.
Super, yeah, that's really helpful. Thank you so much. So what do you think are some of the signs that caregivers can watch out for that might indicate that a child needs more support?
So in children and youth, actually the two most common mental health conditions are anxiety and usually some sort of a mood issue. And so I can speak about some of the common symptoms that would arise if a child was suffering from these two conditions. First of all, children, especially young children, will show you that they're not well. They're not necessarily going to tell you. They don't have perhaps the emotional vocabulary or the sort of cognitive development. They're not at that stage yet to sort of clearly articulate how they're feeling. But watch for any behavioral changes. That's usually going to be a red flag that something is happening. So we're talking about changes in terms of their eating patterns. Have they stopped eating? Are they overeating? How is their sleep? Are they oversleeping, taking excessive naps during the day? Have they flipped their day-night cycle? Are they more tearful, more agitated? Are they struggling with anger and you're seeing behavioral outbursts at home? Some children, will also be very angry, very vocal when they're getting upset. So, watch their interactions between, the children and their siblings as well. That can also sometimes be a red flag. Also, with older kids, self-care, so how they take care of themselves. Are they sort of brushing their teeth? Are they showering, changing their clothes, making their bed? If you had a teenager that was extremely meticulous, perfectionistic, conscientious about their work, and you're starting to see a significant decline in their appearance, in their relationships, they seem more withdrawn, less engaged with the rest of the family, they're not talking, they're not sharing anything with you, again, that could be a harbinger of, some sort of mental health issue. And I think, obviously, as things get more serious, you will start to see that their decline in functioning is also more severe. You'll see academic performance going down. You'll definitely see isolation. And in sort of teens, we also obviously do worry about expressions of suicide or self-harming behavior. And this, again, can come in multiple forms. So it's really important to try to stay connected to your teenager, to ask them how they are feeling on a consistent basis. I know teens don't, readily offer that information. Sometimes as a parent, you do need to take your time to observe and check in gradually. But hopefully, as you sort of establish that connection with your teenager, they will be more forthcoming about how they're truly feeling. And then obviously, if they are expressing clear signs of wanting to hurt themselves, that, as a parent, you would seek professional help for that.
Yeah, thank you. So important. So what are some of the coping strategies and resources that parents and other caregivers can use to help children that are compatible with the measures to mitigate risk from COVID-19, do you think?
So I think, first of all, we really want to help develop that sort of resilient mindset, help children foster self-compassion, gratitude, and hopefully as parents, we're also modeling that as well. I think, with the pandemic dragging on for so long, it's very easy to sort of slip into a mode of just constant complaining and griping. And children see that. They can see what is the sort of tone in the home. What are we bringing back from work each day? And so, are we able to foster optimism and hope for our generation? There's already tons of negative information they're receiving from numerous sources, whether it's from media or from their friends. And so how do we sort of counteract that and provide balance? I think other coping strategies I mentioned, providing opportunities for physical activity, giving them chances to get outside, be exposed to nature, engaging in hobbies, whether it's things like music or art, even connecting with a religious or spiritual community, if that's something that the family values as well. Many individuals find meditation, mindfulness also very effective. And I think the other thing too is that for many teens, what they're really mourning is this sort of loss of what could have been. My daughter personally is going through high school and she's, experienced 2.5 years of being online for the most part. And so there is a sense of loss and grief, knowing that, for most of your high school years, you haven't been able to connect with your peers in the same way. All the significant milestones that most of us as older adults now take for granted, whether it's, your first prom, your first date, going out to movies, they really haven't been able to experience that in the same way. And so I think as a parent, being able to really listen and hear them out, and really to sort of sit beside them as they're mourning this loss, as they're coming to terms with, what is instead of what could have been.
Yeah, thanks. So helpful. What kinds of supports do you think children are going to need to transition effectively to a post-pandemic way of life? And maybe I'll ask the other part after.
Sure. So I think the world that we are currently living in and will continue to live in is one that is highly complex. It is unpredictable. And I think that the skills that our children will need are skills to really navigate that type of environment. So our children need emotionally and psychologically stable caregivers and educators who are going to help them navigate complexity, who are going to teach them problem solving skills, who are going to help them sort of think through issues. And, we see this over and over again with teenagers, in the hospital system. They get increasingly dysregulated when they see that their parents are also dysregulated and not handling stress well. And so, I think for families, if there's a way for them to really shore up their own sort of resiliency, their own capacity to tolerate stress. So whether that's finding their own set of coping strategies, talking to other people, building a strong social support system for themselves, that's going to have tremendous sort of trickle down effect on their children. And we need parents who are going to be able to raise children that engage in dialogue constructively and think through issues objectively, even when the stakes are extremely high and difficult to manage. I think oftentimes, so often, I guess, like on social media, you see people engaging in sort of really hostile sort of conversations. They're not really dialogues anymore. They're just serial monologues. And our teens are learning from that. And it's, I think, leading to increasing polarization for our children. So if we want to, I think, survive and thrive in a post-pandemic world, we're going to have to help build up again those skills to foster human connection. Just as there's been a loss in terms of kids' academic progress, kids are behind in certain academic skills. I think that there's going to have to be a catch-up as well for their social skills, and also teaching children to develop traits such as altruism, integrity, collegiality, really giving them a sense of civic responsibility and duty, because we are living in a global world. The actions that we engage in do have an impact on others, and increasingly, I think our children see that, and they'll need to know how to work through issues together.
So true. So what kinds of questions and concerns do you think we should expect when, say, mask mandates are dropped? What sorts of things do you think children are going to come to us with, and how should we respond to those?
I think children will be confused, to a certain point. They've been told a specific type of narrative early on in the pandemic, that this virus was, deadly, that it's highly transmissible, that you have to be extremely cautious. And now I think that narrative has been changing in the public discourse. And so for many children who don't have that, cognitive ability to tolerate dissonance yet, you speak to an 8-year-old, things are pretty black and white. So if we're talking about changing a narrative that is drastically different, we have to be able to explain that to children in a way that they can understand. And I definitely do see many kids where, even if they're given the opportunity now to return back to in-person schooling, they're opting out of that because they are afraid, and they've been told to be afraid for 2 years. So now when we're saying that actually this virus, presents, or this variant of the virus presents slightly differently, and now that you've been vaccinated, you should be going back, I do think we do have to think about how we're going to address this specific shift in the narrative, how they understand risk, and also to a certain degree, understand their feelings around that, because it is very confusing. There's a whole host of feelings that kids are developing around not only getting COVID, but also potentially spreading COVID to their family members, to their friends. Some of them are feeling very guilty and ashamed and embarrassed about it. So these are all new concerns that are arising as we're moving out of sort of like a strict sort of lockdown type of approach, or sort of more of like a zero COVID approach, to one that is looking at COVID's going to be with us. COVID is endemic. So how are we going to tolerate living with COVID?
Yeah, great points. And so can you tell us about how the pandemic has affected access to mental health services?
Sure. So in general, access to mental health services has been problematic for a very long time. I think the pandemic has only just highlighted the sort of difficulty. So even prior to the pandemic, wait times to seeing a child and adolescent psychiatrist could have been anywhere between 6 months, 9 months. In some sort of subspecialized populations, it would have been even up to a year or two. And now we're talking about having a greater proportion of kids that are reporting anxiety, depression. So obviously wait times are longer. There's also been difficulties with certain services remaining open, certain day treatment programs that used to exist as in-person support. So kids would actually come to the program, they would be doing a portion of their day, receiving mental health supports in addition to schooling. A lot of those programs have pivoted to virtual, to sort of virtual offerings instead. And that doesn't always work very well for kids with mental illnesses. Some programs have actually shut down. They've lost staffing. There's high sort of rates of burnout, turnover. So I think, if we look at access in general, it remains an ongoing issue. There have been some positives, though. I think on the adult sort of psychiatric end of things, the government has put in some new programs which offer sort of online cognitive behavioral therapy. And so that at least provides some sort of like immediate psychological support and access for patients. But on the youth side, there is still a great need for child psychiatrists. We definitely do not have enough across the province or across the country. And I'm hoping that the government will consider funding more positions for child and adolescent mental health, especially in training clinicians, and also putting more funding into schools, because we know that schools are usually often the first place where kids will feel comfortable coming forward and sharing their concerns. If we don't have enough social workers or mental health nurses in the school system, it's going to be really hard to service all the kids. And I think the last piece, if I can comment on one more thing, is also really shoring up support for our primary care physicians, whether that's family doctors and pediatricians, because obviously by the time they come to see a psychiatrist, they've actually gone through another sort of provider ahead of time, right? It's referrals come from primary care physicians. So usually with primary care, they're dealing with the bulk of the anxious kids and depressed kids. So they definitely need support as well. And I think that, if we could really advocate and get more support for both schools, for primary care, hopefully we'll be able to really reduce then the overall wait to seeing sort of mental health clinicians.
Yeah, so true. Always the case. So the last sort of area we're going to talk about is how can we make schools safer and better, and how do we open schools and keep them open?
So I think, keeping schools open is definitely a priority. And the ways that we can do that are, numerous. We need to have kids vaccinated. We need to have them protected. We need to have good masking policies. Right now, we know that COVID is transmitted, through aerosols, in addition to droplets as well. And so I think having a very clear messaging around vaccinations, around masking, ensuring that we have good ventilation systems. Many schools are not outfitted properly with HEPA filters. So if we can put the money into fixing the infrastructure. I think there's also, because we're starting to recognize that COVID is going to be with us for a very long time, I think there should be increasing dialogue as well about how the academic year actually plays out. Perhaps there can be, shifts made. The calendar year of September to June may no longer be a feasible one for us in this COVID-19 world. Maybe we need to start thinking more creatively about how can we optimize learning for the summer months when kids can be more sort of in outdoor environments. Is there a way to sort of stagger learning throughout the year? This has actually been talked about in educational circles for a very long time. We know that there is a loss of knowledge during the summer months anyway. So is there a way to restructure our academic year and even that's implication for parents' work schedules too. Now that we know that in fact kids can learn virtually, is there a way to also have hybrid systems that are more sustainable, so that kids don't have to be forced into an all or nothing choice where it's either all online or all in person? Because there may be periods where we see surges in COVID-19 cases, where the healthcare system is about to be overwhelmed. Can we have more agile school structures in place where kids can move between these two sort of modalities of learning and not suffer sort of intense academic consequences? I think the other thing is, we really want to engage families in this process of making schools safer and better. I think families know what works for their children, whether it's maybe smaller cohorts of kids, perhaps, thinking about how we could have more community involvement. One of the big concerns that, that I think about is when teachers are sick, the impact that has then on the entire school. And so can we start enlisting other forms of educational support for kids? Because we know that there will be ongoing staff absences. So what can we do to mitigate against that? These are all really important discussions that I think should be happening. But it is going to be an ongoing dialogue between multiple sectors, between the medical professionals, mental health professionals, and also our parents and our students as well.
Excellent. Thank you so much for taking the time to talk to us about these really important issues and how to better support our kids. It's really great to speak with you.
No problem. Thank you so much, Christine, for this opportunity.